And this afternoon, JoyNews is learning that the Ghana Health Service and officials are racing against time to prevent what could potentially be the spread of the monkeypox disease after 5 cases of the rare infection were confirmed in the country. These were from 12 samples collected across the country. Now, though the first cluster of the latest cases of monkeypox were detected in the United Kingdom, the disease is fast spreading in Nigeria, Cameroon, and other West African countries. This afternoon as well, Ghana has become the latest to record the case in the West African area, Eastern and Greater Accra regions as well, we're understanding some of these cases are coming from. Manol Kranting is a member of the health desk and also attended that news conference. He is joining me via Zoom to give us a breakdown of what it is that we're learning of this virus. Manol, thanks for your time. So quite a scary situation, but I'm sure that the health officials are explaining what they're doing to put everything under control. But first of all, give us details of where these cases are actually coming from.
Also, Blessed, these are 5 cases which were confirmed from 12 samples collected from various parts of the country. Indeed, we're told that a total of 3 regions currently have confirmed cases of monkeypox here in Ghana. Particularly, you'd have the Greater Accra region, you have also the Western region, and the Eastern region. All of these regions currently have confirmed cases of monkeypox, and so that's by way of details and of course the distribution of the cases that we have in the country. We can just briefly listen to Dr. Patrick Umabwaji as he gave details of this particular outbreak at that news conference.
In 3 regions, Eastern, Western, and Greater Accra. This is where we've found the 5 cases. No deaths has occurred among the cases. One of the cases has been recorded in a Ghanaian who traveled to the United States from Ghana. So I picked it from here. It shows as fever, some swellings in the armpits and groin with the lymph nodes. We have headaches, muscle aches, and general body aches. That's how we went. And then, of course, then the rash and the blisters will appear. That's how monkeypox is. That doesn't mean that every rash is monkeypox. There's clearly no treatment for monkeypox. Fortunately, it's a mild to moderate case, and so especially the West African one is mild to moderate. So we only treat at the symptoms. If you have fever, we give you something to bring your temperature down. Body aches, we give you some painkillers to bring it down. You must make sure that the skin lesions are kept clean. You boost.
Okay, then. So let's give you a breakdown, first of all, of the cases we have, where we're having them come from, and what it is that you need to know about this. It's on your screens right now, giving you an overview of what we're talking about. So here's the case of monkeypox, and we know that is a zoonotic disease caused by monkeypox virus, and beyond that, we also do know that it's actually endemic as we speak in neighboring countries such as Nigeria and also some other African countries, including Cameroon. Now, it is transmitted from an infected animal, where squirrels, rats, and monkeys as well, or from infected humans. So it's transmissible. And then we also do know that human-to-human transmissions can occur through a skin-to-skin contact, if you have a face-to-face contact as well, and a mouth-to-skin contact, that can actually be a ground by which you could be attracting the virus. But then it can also be spread through touching, towels, clothing, or other objects used by an infected person. So if you're wondering what the virus is about, that's an overview for you. But in terms of the signs and symptoms, we have fever, you have the swollen lymph, and also headaches, muscle and back aches as well. General body weakness is part of the symptoms that we're getting from the health officials on this matter. And then you could have some rashes with blisters on your face, your hands, and some other parts of your body, including your genitals as well. So these are some of the features, signs and symptoms of the viruses we're talking about. But for now, we do know that a total of some 12 suspected cases of monkeypox have been investigated since the 24th of May 2022. However, 5 is what is confirmed in our country today. Regions is what the focus is telling us, Eastern, Western, and then Greater Accra. These are some of the early detection points. We are unable to tell at this moment if there will be any more cases in the coming days, but we're certain that there are no deaths. There's only one case which has been confirmed in terms of a Ghanaian who traveled to the United States of America. So that's the point from which we're having the infection. And now, as we speak, there are over 1,000 confirmed cases of monkeypox cases in 29 countries. So that's the overview of the cases that we're dealing with here in the country in terms of the monkeypox virus. I'm sure that many of you have questions and are wondering what exactly this virus entails. There's a need for us to hear from the experts and also try as much as possible to hear from them, know more about the virus and what it is you can do out there just to be safe. So we'll be bringing all of that to you. We'll be speaking shortly to Dr. Thomas Anaba, who will be joining us via Zoom. He's with the Africa Center for Health Policy Research and Analysis. We'll also be hearing from the Ghana Health Service as they provide us with some perspective on the matter. But here's a pictorial view in terms of the global map. As you see it here, Europe appears to be the hotspot in terms of the early detection that we're talking about. So you have many of the cases spread across Europe, and then parts of North America, and we have South America also having some dotted cases around there. But here we are in Africa, and it appears that apart from the northern parts, Ghana appears to be some of the early countries in the West African sub-region recording cases. Then we have some dotted cases as well in Asia, and Australia is also having its fair share of the situation. But for those of you who are wondering where exactly the hotspot is, it's in Europe, but it's surprising that the virus was transmitted this time around in our case from from America itself. We're not sure if it's from the northern part or the central parts of America, and that's where the person traveled to, as we're hearing from the Ghana Health Service officials, traveling back into the country. So it appears that it's a case of importation. That's what we are learning of, and that's the indication we're getting from the health officials on this matter. And also, we are hearing that initially, as of May 2022, some 12 cases were investigated. And then, obviously, what we're dealing with now is that 5 have been confirmed. We'll try as much as possible to get some of the health experts talk to us shortly. We'll delve into the matters in terms of the cases that we're hearing of, what you need to know and how you need to go about it. We'll also be telling you about the official indications we're getting from the Ghana Health Service on this matter. It's all coming up here on The Pulse. Please stay with us. Let's now bring in Dr. Oliver Comey. He's with the Infectious Disease Surveillance Unit of the Ghana Health Service. Earlier, we're telling you about the discovery of the monkeypox virus. It's in Ghana, 5 cases confirmed. Dr. Thomas Anaba as well is with the executive. He's with the Africa Center for Health Policy Research and Analysis. He's the executive director. Thank you for joining us. So, Doc, let's start off with you. The Ghana Health Service is giving us a clear indication on that. Dr. Anaba, before I come to you, let's hear from the Health Service as to, first of all, whether or not we should be worried, especially as we seem to be hitting some viral infections alongside with neighboring countries such as Nigeria. What should we be expecting from your outfit as the Ghana Health Service?
So, thank you very much and good afternoon. Sorry, I'm not able to share my video, so I hope the voice is okay.
That's perfect.
Okay, so today we all heard the news about 5 cases of monkeypox having been recorded in Ghana. The question you asked is whether we should be worried, and the answer is we do not have to be worried, because Ghana is one of the 10 endemic countries where monkeypox already exists. But Ghana has currently been identified only in animals, so we are expecting it. We are seeing it for the first time, maybe in humans. But be that as it may, across the West African sub-region, monkeypox is an endemic disease. So we do not have to be worried about monkeypox. The reason why a lot of noise is being made about monkeypox because we are finding monkeypox in non-endemic countries. If you should find monkeypox one case in a non-endemic country, they will be worried. But to find monkeypox in an endemic country, we do not have to be worried.
But what's surprising is the point of importation. It appears that someone is bringing this in from the United States of America, as we're hearing from the health service. What's accounting for some of these transfers, if I could use that word loosely?
If you say that you are hearing that, I don't think we are telling you that it was imported into the country, because for us it's an endemic disease. So then let's say maybe you are seeing it in a person who is not living in an endemic area. So to say that it was imported, I'm sorry, I cannot speak to that. Now, when it comes to monkeypox, transmission generally is direct contact with either the fluid from the rash or from the beddings or utensils that somebody has used. We might say that monkeypox is common, and maybe if one person is in the family gets monkeypox, you may tend to have a cluster in the family getting monkeypox. It's mainly by direct contact.
Okay, these are some of the signs and forms of transfer. But in terms of the symptoms, what are the general features for you to see and be able to tell that this is someone who is suffering from one of the infections?
Okay, so unless the person complains about having the rash, together with you, the doctor, finding out that the person has swollen lymph nodes. When I say lymph nodes, they are the lymph nodes respond to infection. So sometimes people call them the glands. You may have them around your ear. Typically, they may be swollen either in the armpits or around the groin. If you have a fever, if you have a rash, and you have swollen lymph nodes, then you can think about monkeypox. Monkeypox resembles either chickenpox or measles. To be able to differentiate between the three of them, monkeypox usually will go with swollen lymph nodes. If the person hasn't got swollen lymph nodes, it will be quite difficult for you to distinguish that from either measles or chickenpox.
Anyway, and the concerns about vaccination. It appears this is not a new virus, so it's fair to suggest that you have vaccination under control, right?
So let's say that monkeypox falls within the same family as smallpox. And we must say that it's been documented that if you give the smallpox vaccine, it can take care of the monkeypox. Having said that, they've also come up with two new vaccines, but that is not widely used as of now.
I'll be coming to Dr. Thomas Anaba shortly so we can get some more perspectives on this. But as we wrap up, the concern about the outlook, we could bring back the map for you just basically so we can see the level of spread. You see parts of North America, South America, and then the concentration is in Europe. Are we heading towards another situation where we could have, I'm afraid to use the word, a pandemic? Is that far-fetched? Dr. Oliver.
Hello?
Yes, Dr. Oliver, I'm asking if it's far-fetched to say we're moving towards...
No, let me share. Okay, so that is the picture, but let me also share with you cases of monkeypox in endemic countries between December 2021 to May 1st. The key countries here are Cameroon, Central African Republic, DRC, and Nigeria. So for Cameroon, they've had 25 cases from last December. Central African Republic has recorded 6 cases. DRC has recorded 1,238 cases. And Nigeria next door has reported 46 cases. Those other countries, the non-endemic countries, are recording 2 cases, 4 cases, 5 cases. The key thing I want to put across is there's no need for us to go into a panic drive just because some people are recording 4 or 5 cases. These are an endemic diseases, and in Africa, the numbers I gave you, we recorded close to over 1,400 cases already. But we haven't made so much noise because we are able to manage it.
I was about coming to that, and that's why perhaps the public is anxious now, wondering what to be wary of, how to step out, and what to be, on the lookout for. What's the general advisory on that?
Okay, so that if somebody has monkeypox, the best way of protecting yourself from getting monkeypox, we said it is by direct contact. So you need to protect your hands. So you need to wash your hands well. You need to make sure that you wear gloves if you are managing somebody with monkeypox. You need to make sure that the one who has monkeypox, is wearing protective clothing, let's say long sleeves, or let's say trousers, so that you do not come into contact with the crust or the rashes. For the person, you also need to make sure the person wears a mask. And if you are the one who is managing the patient, also wear a mask. All I'm trying to say, all the things we've been doing, wash your hands, wear gloves, use your nose mask, it's the same thing you do for any virus. So I will say that we should just need to, the kind of things we've been doing, we just need to make sure that we are following the same things.
All right then, Dr. Oliver, thank you for joining us. Let's hear from Dr. Thomas Anaba, who's joining us via Zoom. Dr. Thomas Anaba, if you're with us, so you at the Africa Center for Health Policy Research and Analysis, obviously we're told that this is an endemic region. Should that give us a great assurance that the health officials are equipped enough, have enough capacity to contain the situation? Yes, Dr. Anaba, I was asking if, we're being told now, just a while ago by Dr. Oliver, that this is an endemic region, so it appears we're not new necessarily to this virus. Does that mean that we have enough capacity to contain the cases? Kindly unmute for me so I can hear the point you're making, Dr. Anaba.
Worried at all about this? Thank you. I'm saying I can't but agree with Dr. Oliver Komi for his excellent presentation, and then trying to tell Ghanaians to feel free and not to be alarmed about this disease, simply because it is just like we have malaria in Ghana. If the US is reporting malaria, Ghana shouldn't be bothered about malaria, because we already have it here with treatment, and at least we know how to manage it well. So this monkeypox is something that has already been living with us. Just that we don't see it in those numbers within Ghana, but other countries are suffering it. Just like he has mentioned, he's given a total of 1,000-something cases in West Africa recently. And that the management is virtually the same way that like we were used to manage COVID-19. The prevention is the same way we used to do for COVID-19. So now I know we are all used to it. What we just have to do is that when we see somebody with those boils on the body, let me call it boils for the ordinary person on the body, try to let him go to see a doctor for them to make sure they differentiate it from the other forms of diseases that are similar. And if it happens that they diagnose him of monkeypox, then they'll give him all the necessary support and preventive measures so that he doesn't spread it in the community. But Ghanaians should be calm and shouldn't be rushing to do anything. Monkeypox has been with us for a long time, and it won't do any serious harm to anybody if he contracts it.
If you're saying that the protocols are almost the same as the COVID-19 pandemic, is this really the time to reopen the detention facilities to at least accommodate persons who may be detected of having the infection?
We don't need to. Most of the symptoms are not that very bad. You don't need a doctor by you all the time to manage you. You can easily be managed even from your home. So this doesn't really need any special detention center for it to be opened. What we just need to do is to make sure we advise anybody who is positive, advise the family members on how to behave with him. And just after 2 weeks, he'll be fine and everybody will be fine. The only serious thing that may happen to him is that he may have some scars that may damage his aesthetic, and maybe he has to be wearing long sleeves and long trousers all the time, anytime he's going out, to cover all those scars. But monkeypox in general is benign. Yeah.
And for policy
measures, government should educate the public like you are doing right now. Get more media houses to educate the public about its presence. Get the doctors and nurses recapitalize on it, and then at least have suspicion anytime they find anybody those boils on the initiation, and if it is monkeypox, they treat it. I think these are some of the things that we should do.
In terms of stigma, is that likely to be a challenge for persons who may be treated and discharged?
No. I don't think there will be, because people get chickenpox in Ghana and they have those scars in their body. So it's just similar to chickenpox. It's chickenpox, anything like a stigma, unless we start preaching very bad news about it to make people fear it. But there shouldn't be any stigma to anybody who recovers from monkeypox.
How about the issue of vaccination?
How for the vaccine, as Dr. already told you, the vaccine for the chicken, able to manage it. I don't think that we have the two new vaccines that they have in other countries that are not endemic. So whatever we want to do now is to make sure we educate the people and don't get to a stage that we'll be having what we call need to give vaccine to everybody. That is going to be a cost, simply because its effect on the human body is not so dangerous, it's not so lethal that we should spend a whole lot of money that we even need to buy coronavirus vaccine we are not getting. We should just educate people and they will be able to minimize the spread and down the rate. Okay, then, Dr. Anaba, as we wrap up, what's your message to the public in these times as we're learning of 5 new infections? Thank you. I'm just repeating what Doctor said. Everybody should be looking out for any unusual boils on the skin, so that if you see it, go to doctors for them to determine whether it is monkeypox or not. If you go to hotels, hotel owners and hospital owners should make sure linens are washed properly, and we don't use the same linen for people who are suspected to have monkeypox. Disinfectant, spray on their seats and then the rest, and clean them well. If they suspect somebody with boils have come into the car and travel into the car, so that it limits the spread in case the person was positive. That is what I would advise. All right then. I guess it's time now to hold on with this conversation. We'll get back to it. But Dr. Anaba, thank you. Now, the Christian Health Association of Ghana and medical diagnostic giant Medtronic labs have begun a project to screen and give free medical assistance to 75,000 Ghanaians living with hypertension and diabetes in rural communities across the country. The joint project, aimed at curbing skyrocketing cases of 2 non-communicable diseases, will be implemented over a one-year period. Now, community health workers in 85 health facilities across 8 regions are undergoing training to extend service to disadvantaged communities. There's more in this report for you.
About half of all deaths in Ghana are attributed to non-communicable diseases. An estimated 50% of the Ghanaian population are hypertensive, with less than a third of the population diagnosed. Lack of diagnosis and treatments are contributing factors of these deaths. The Christian Health Association of Ghana, CHAG, is rolling out the Akomapa project to minimize the life-threatening complications associated with hypertension and diabetes. Inokoseya Dade is the Director of Finance, CHAG.
We have about half of the population who are suffering from the NCDs. But as we indicated, most of the times, because we don't go to hospitals to find out, so hardly do we know that we have such conditions. We are looking at the hypertension and the diabetes. So that is the main essence of we looking at the Akomapa project that is focusing on those 2 disease burdens.
A joint implementation partner, Medtronic Labs, has been designing a mobile app for patient data collection. Community health workers at 85 health centers across the country are undergoing training to facilitate the collection of data to receive customized care plan and medications. Debbie Mangorte is the program operations manager at Medtronic Labs.
Our role in this particular project, or the support we are giving, is basically using our tech solution, which is the SPICE. This SPICE would generate a care plan that shows that I should probably check my BP every 2 weeks and come for management or review every 2 months. So depending on the patient risk level and their biological readings, that is the BP, or blood sugar readings, SPICE is able to generate a care plan, and this enables the patient or the care providers to be able to see how a patient is doing at a glance.
The Akomapa project, which commenced in 2021, has since enrolled at least 30,000 patients, with over 4,800 of them achieving a drop in their blood pressure levels. Some beneficiaries recount how impactful the project has been.
I was eating everything and anything. Then some be to medical hospital now. Almost every checking the BP, that's about 190, 110. The initial say by
For JoyNews, Emmanuel Bright Kweku reporting.
And you're welcome back to The Pulse. Now, 4 persons, including a local radio presenter with Tamale-based Nasim FM, have died following a suspected robbery attack on a mobile money vendor at Kalariga, a suburb of Tamale. Now, according to some eyewitnesses, the radio presenter, mobile money vendor, was attacked at his business center and shot dead. Now, 2 other victims, including one Efa Razak, a bypasser, and also one of the alleged robbery suspects, also died in that attack. A 4th victim 9 days ago, the Ghana Police Service, in a strongly worded statement, fought off claims by the Ghana Bar Association that there was an upsurge in crime. Well, this was at the same time, of course, the nation was coming to terms with the gruesome murder of an Accra-based lawyer on the Bolibamboy Highway. There have since been at least 4 different armed robbery cases in various parts of the country, sparking serious concerns about the state of security. So is this the time to obviously claim that we're going back to the days of increase or a surge in robbery cases? So we can bring you excerpts of a police statement. Obviously, we'll do that shortly. But let me first of all welcome Richard Komado. He's a security analyst joining us to assess all of these happenings and also find out if indeed official figures at his desk prove otherwise or actually back the concerns that are being raised. Richard, thank you for your time here on The Pulse. So let's first of all go back a bit, look at the concerns of the Ghana Bar Association. In fact, a couple of days ago, they were raising concerns about how violent attacks and crime was on the rise. Are you also sharing that view and coming to terms with the reality now?
I think the numbers are going up. And I think 3 weeks ago, 2 weeks ago, and last week and this week, the pockets of attacks we are hearing and those involving death, and the numbers are going up now. So I recommend and I suggest the IGP goes back to operations and provide leadership, because that is where his strength is. And once he can rejuvenate his base, putting out an operational team that is a bit more aggressive in controlling the public space, they may be able to prevent crime and the murder of Ghanaians will be stopped. After all, that is the predominant reasons why he was appointed as the IGP, and people will want him to do that. Other than that, then his critics will say he's losing the job and the pressure of the job is getting to him, and he should be shown the exit door.
If you make that statement, obviously there'll be the concerns about the figures as to whether or not they back the claims that both the Ghana Bar Association and some stakeholders, including you, the experts, are raising.
No, definitely. From the day the WA lawyer, Accra-based WA lawyer died, the series of attacks in Tamale that you just reported in Kumasi, your own data from Joy, the job you have done when it comes to robbery and crime and criminality across the country, I think the numbers are a little bit going upwards. And I think the IGP should not be distracted with political activities. We should allow him to go back to policing. That is where his strength is. And he's somebody I love and I support him to succeed. I wouldn't want him to be changed because, brother, you know why? He was brought in on the basis of crime prevention because his predecessor did not do a good job. And to the extent that you have the Ghana Bar Association coming in, you have the Christian Council, you have the Catholic Association, it wouldn't just be some of us who are edging me on but it will be people who are also seeing from far and they are raising their voices. And I think there's a rare concern here, and we need to support him to do a good job.
Is it the case of low police visibility, or what more is accounting for this?
I think they've lost track a little bit. I should think he has taken off certain people who are very quick in the field when it comes to security operations. And I think some of his frontliners have created operational challenges for him, and he's trying to rejuvenate the base, aligning operational capability with the resources available to him. And within this public space, the rebels or the criminals have realized that the police have been invisible in the street, and they are taking advantage. Because, bless you, see, when it comes to crime prevention, one of the things that happen is that both the police and the criminals fight to control the public space, and whoever has an upper hand determines the pace. And I think for the past 1 week or two, the criminals are thinking to have an upper hand. Do the police have the capacity to come back? Yes. Do they want to do it? Yes. Would they be willing to do it? I'm urging them on. And should we consider them and encourage them to take the front line as law enforcement officers in the 21st century? That is what we are urging them on. And we want to see strictness, we want to see professionalism, we want to see high levels of determination of a credible police force who is willing and able to fight crime to the highest level, and not the carelessness some of his men has put him on in the recent past.
I guess admitting the situation is part of solving the problem. The Ghana Police Service is, in fact, disputing the figures, talking about how their men are always on the ground in check and making sure that crime does not surge. So it appears that Ghana Police Service is not on the same wavelength with all of the stakeholders in terms of the matters that you're pointing out.
I think the pressure of work is getting to the IGP now. And the heavy bars, like the heavy personalities in society, like the Christian Council, the Ghana Bar Association, the trouble he had with the British madam, all that is taking his attention from the focal point. And the robbery that just took place around the Kumasi area, we understood the police post is just about 10 meters away from the place. And one of the reasons they are giving is that lack of men and police logistics when it comes to car. You don't need a soothsayer or a tribal or a traditionalist to tell you that they are killing people in the roads. And in the face when we are talking about terrorism and coup d'etat as a major threat facing our country, I think we can deny, and that deniance is good anyway, but then the reality is that people will complain. And I'm not someone who complains about my police force. I believe in them, and I want them to put the right men at the right places at the right time. And that is the only way they're going to get the results. Other than that, the figures from their own statistical service department within the Ghana police will tell them the crime levels they are recording on a daily basis is going up.
Is it just about the IGP? I guess that's the question always facing us. Because it appears we're putting everything at the doorsteps of one man who's working within a whole police service.
No, you think it's a policing or law enforcement is leadership. It's a leadership tool. And when Dan Parry came, you realize he brought in a different style. You realize he brought in a new leadership. And that was what gave him the results. It wasn't because he did something new. It was just about leadership. And his leadership style, resonates with the grassroots. His leadership style, rejuvenate the base because he has been with the welfare department for years. Okay. All the people he works with are people of integrity around him. And once he's losing focus on leadership, he's going to have problems. That is my fear, I'm afraid.
Richard, just hold on, because we're also keeping our eyes on this alleged explosion we're hearing of in the Enya area. In fact, the District Security Council is disputing the accounts. Just hold on. Let's hear from the MCE. I'll come back to you shortly. Mohammed Bashir is MCE for Enya. Thank you, sir, for your time. So are you able to confirm or deny now if the supposed explosion we heard of is indeed confirmed or otherwise? What's the official report you have now?
Thank you very much. In the first place, let me correct the erroneous reportage that has been put out there in the public domain and treat all of us to be circumspect in reporting issues that are hyper security sensitive. I read on especially my story online that there is alleged dynamite explosion in a place around Santa Maria and came alarmed. And most of the journalists who came to the scene today to interview us, I think that's what they picked their source from. I'll plead with everybody. Let us try as much as possible to check and double check some of these issues.
So exactly what I'm doing now, sir. I'm asking you if you have official reports now and what the official reports are telling you.
Assuming, nice gentlemen of your caliber, you are sitting in your video at your workplace, then somebody says it is alleged that somebody has slapped you. Your followers, people who like you, will react. They'll forget about the alleged that is attached to the story.
I get your concern, but I get your concern, and that's why I'm presenting you with the opportunity to tell us what exactly the official reports are telling you. So what do you have on your desk as the head of the Municipal Security Council?
Exactly. So yesterday, I think around 4 noon, there was a woman by name Xavier who peddles in Ghana. Then the place that she usually sells products is Santa Maria, Anchor of Hope area of Ecuador. And then, according to her, she went past a guy. I don't know his name, although I've spoken to him at length. Then he called her back to patronize a Ghana. So when she was making her way to deliver the product, she says she stepped on something, then she heard a loud sound. Now she continues. Listen to this aspect very well. In spite of the loud sound that she heard, she continued to deliver the product to the customer. Then he was the one who drew her attention to the blood on her toe. He said, if you are what crap, then she went to the hospital. When I went to the hospital officials narrated that.
Yeah, so what's the conclusion? Basically, it's not a case of dynamite or some explosives that were there. Hello, Zed. Okay, it appears we've lost Mohammed Bashir there, who's the MC for Anya. We'll definitely work the lines again, have him to give us a full detail of what the Municipal Security Council has in terms of official reports on that matter. Richard, you're still with us. The MC obviously not happy about suspicion and the allegations that have been peddled around. But what do we need to do in this case? We know that the place has been cordoned off, and yet business is continuing as usual in that community. Is that safe as we speak?
No, definitely, you would need a police crime scene to get to the ground. You would need a military officer specialized in bombs and explosives to get to the scene. And once the place has been called off as the typical crime scene area, they will want to find out what really happened. So these things are, they are easy things for them to just, even if they can even reconstruct the crime scene to come to some level of conclusions as to what really happened.
And what's amazing about the story is the victim herself is able to hear the loud bang, and yet she's able to continue to deliver the item. That's quite surprising.
I have no clue, but I was a little surprised when the MC, who is supposed to be the head of security, doesn't really picture what the security questions you were asking him was. And I also heard the IGP said his men should not speak these days, except the Corporate Affairs Department of the police. So you can see the confusion. The head of security doesn't really understand some of these things when it comes to area of security. As to whether the woman delivered the stuff or not, bless you can be shot a gun and you are not even aware you have been shot. A cutlass will enter your body and you, the victim, are not even aware. You may walk at a distance or you may travel at a distance or something could happen. But that is not to dispute whether there's an explosive or there's a dynamite or there's a bomb or not. I'm saying that let the professionals get to the scene, let them do a good job so that the media can have the right report and begin to speak about it. And
yeah, but we have some of the images on our screens now. It appears that just a toe has been affected. As security experts,
I'm seeing a lady with a toe and I think a drip on her hand.
Precisely.
I don't know where this one is coming from. But
typically, is this how explosives work? I guess if an explosive detonates, I'm not sure we should be finding, some parts of the body by now.
I think there are different categories of explosives, and I don't know, is it even explosives at all? What type of explosive? Where was it found? Which area is that? Do we have mining companies here? Is somebody transporting it? Is it a trap they set for her? Or what really happened to her feet? Or the human being as a whole? I think the security professionals, particularly my men and women at the crime scene, the police crime scene, I believe that I've worked with them over 10 years. And these are people I know I can sleep and beat my chest and say they will do a good job.
Okay,
let's allow
Richard,
them to do a good job and we'll go.
We have one more opportunity, Richard, to hear from the MC, Honorable Bashir, who's joining us now. Earlier I was asking about the exact steps you're going to take next. What are we to expect in the coming days to confirm the reports or what it is that you're suspecting from your table?
Good, thank you very much. Well, the land was transmitted, and just because before the land was transmitted, I was trying to explain to you the measures that we've taken. So since early dawn today, we've had a series of meetings. The Odoko Divisional Commander, the Anya District Commander, together with other security couples, including officials from the intelligence unit of the Ministry of Defense. So after our meeting, series of meetings, we all moved to the scene. We wanted to see evidence of the explosion. Maybe cells, maybe overturned ground, and so on and so forth, or maybe destruction to building, etc. Because the reportage out there was that there was an explosion of dynamite. We realized that the ground, the soil, it has been intact. You could tell that for years it has never been touched, actually, i.e. means of maybe excavated or etc. And it became very difficult for us to, pinpoint exactly whether what kind of explosion there was. So the military intelligence unit, they did their preliminary investigation. Then we spoke to eyewitnesses. My brother, each and every eyewitness we spoke to gave us different accounts of what happened. We spoke to the guy who says he called her back to buy the granite. He pointed to a place where he claimed that the explosion happened. Then we combed the whole place and realized that there was no new soil. There was soil that had been overturned for you to use as evidence. The other person came. He also pointed to a different spot where he thinks the explosion happened. So it became...
Okay, so basically what you're telling us is you're dismissing this possibility of the case of some explosives detonating in the area.
Let me say on authority that there was no dynamite explosion.
Okay, I'm sorry, just before you make the point, you know your area so well. Is this an area that has a lot of quarrying activities going on, or do you have any form of sunwinning or any form of activity that may require the use of dynamite?
The nearest corridor we have is CP.
Where? I didn't get that, sir.
RCP. Now it's RCP, right? Manual construction and product. That is the nearest quarry that we have, and it's 8 kilometers away from the scene. Now we are trying to unravel what exactly happened. That is where we are now. The lady in question, we went to the hospital interview, and then we also say that the assembly has taken care of and is going to take off all her dogs. That is what I've instructed the assembly to do. Okay. They are going to transfer her. And then we interviewed her initially at the hospital with patients. We don't allow them to be patients to be interviewed. But because of the reportage, I pleaded with them to allow the journalists in. They came, the patient was there, they interviewed the lady, they took pictures of her. They had a lovely conversation with her. Now let me quote what she said. She said she stepped on something. Then she heard a loud noise. Then she proceeded to the guy to deliver the granite. She didn't even know that she was injured. Let me ask some questions here. It's worrying that, a human being is injured in whatever process or whatever way. And that is the main reason why on humanitarian grounds we are, putting the bill. Somebody who has stepped on dynamite that has exploded, my brother, he wouldn't be at the hospital walking, talking, and so on and so forth. If there was dynamite explosion, at least you could see destruction to the soil. If there was dynamite explosion, the walls of the houses, mind you, it happened in front of a school, Anchor of Hope. So all the walls would have gone down. All these are mysteries. The whole thing, in our interview, somebody said, is a spiritual explosion.
All right.
We want to find out what explosion there was. What happened? Was it a firecracker?
Okay. So I guess
it's not dynamite.
Right. I guess that's what your investigations will definitely unravel, but I'm grateful.
Yeah, we are waiting for the military intelligence and those who are in charge, the experts, to come out with their report so that we do it ourselves.
Honorable Bashiru Mohammed, thank you for joining us. We also have to wrap up. So, Richard, in just a minute, let's wrap up on this conversation.
Mercy now, with this particular one, what is important is that the victim we are seeing on TV is alive. The police must do their work. And let's put it to bed and concentrate on some other important stuff in our country.
Richard Kumado, security consultant, I'm grateful. We also have the story of Winneswood number 1 in the Echumakonwa district of the Ashanti region, where armed robbers mounted a blockade and robbed at least 4 vehicles few meters away from a police barrier. Nana Yaujima has the rest of the story.
With the aid of a defective saloon car and some locks, the armed men blocked the Nweneso to Fuansu Road to aid the robbery expedition. Some eyewitnesses say the defective Fiat saloon car was spotted being pulled by a Kia truck hours before the incident.
Quite say car Kobakra Enshim. Eti media me who said you must car na some can say na car near Trini set on trade ye. Ade omode kobo beria na. Ani sam pa ye kwada sorry ya. Car ya na jono na car na etwe no no. Eno no omode ebebo kro no wo ekwam ha no.
4 buses, all carrying passengers, fell behind the blockade. At gunpoint, victims were robbed of their cash and mobile phones. Driver of one of the buses, Kweku Bedu, narrates the incident.
That's what Omudu Mare, a Google from home. Jerusa accounts are come, I come, and I'm watching Omuraboye.
Residents count not less than 4 robberies this year alone. Somewhere last year, after a robbery incident which resulted in the death of one person, the community decided to put up this shelter you see behind me upon the request of police. Though the community say the police have sometimes used this point to protect the people. It has also been one of the areas that these armed robbers are fond of using to perpetrate their robberies. About 10 meters from the shelter is the area used for the robbery. Some residents are dissatisfied with the work of the police.
Baby, a police for one, Jinana and Robinson about maintenance was a it's IGP, or man and Nimla, South Police for now, more airplanes, so that's what bit must some mamma and I want to some of mine.
Live news checks have revealed inadequate personnel has forced the police on some occasions to station 1 personnel at the barrier. It is unclear whether there was a police personnel on guard at the time of the robbery. Further checks reveal only 1 vehicle patrols the area and has consistently developed faults. Tuesdays are market days for people here at Nyoneso number 1. Many from Kumasi and other communities come in here to trade. But due to the armed robbery incident which happened this dawn, many, because of fear, have refused to show up for trade. And this is affecting sales here.
We started by Hadi, you said, and then you buy and quetchman, so no crama quetch, match mammy coy and crayfield musa or montoshi.
The roads here are poor, bumpy, and dusty. Though awarded on contract, it is yet to realize any major improvement. Samson Chermantin is a resident.
No question is a idea quite dear, Yama at me every payer, a cacron seminal.
Police say they are yet to receive an official complaint, though a personnel was at the scene earlier. For JoyNews, Nanaya Ojima reporting.
And like everything else, the price of sanitary pads has risen. Some women say it is now expensive to menstruate. However, some women in Choko have now chosen baby diapers over sanitary pads because they're cheaper and absorb more fluid. Ifua Aprikwa Bwafo has been tracking the NPP campaign promise to eliminate import taxes on sanitary pads and has the rest of the story.
Ladies and gentlemen, we will eliminate import duties on sanitary pads to improve health conditions, particularly for girls. It's very important, but what we want to really do is to make sure we produce the sanitary pads in Ghana.
That was Vice President Dr. Mahamadou Bawumia on 22nd August 2020, making a firm promise that his party will eliminate import tariffs on sanitary pads if re-elected into power. The New Patriotic Party won the 2020 election, but the government is yet to fulfill its promise. Sanitary pads are subjected to a 20% import tax and a 12.5% value-added tax, making the product expensive for many women. Taxes aren't the only factor driving up the prices of sanitary pads. According to dealers, the high cost of fuel is also to blame.
First, well, now le 5 cedis, 50 pesos, no le 7 cedis. She be at 9 cedis or whole 10 cedis. Ne, what be a no na mengo na make petrol da na no. Or no affect on the
When it's that time of the month, Hagar, a resident of Choko, gets anxious because of menstrual cramps. But the rising price of sanitary pads is also giving her heart palpitations.
If we are entering new month, I become worried because the sanitary pad first, we used to buy it 5 cedis. But now some are selling it 8 cedis and some are selling it 10 cedis.
She is sometimes forced to use unhygienic materials, which can have serious reproductive health consequences.
The money that I was holding at that time is 5 cedis, and it's come by the sanitary pad, so I need to buy 0.
The rising cost of sanitary pads has forced many women to use baby diapers. Diapers are preferred over sanitary pads because they absorb more fluid and require fewer changes. Again, they are cheaper. Ayele explains how the baby diaper is used as a sanitary pad.
Inchio bia no we fiat me fio spirit ka gbe nkagme papa se an ke ki ye 1 cedi e wa mi an ke agba ke dan ma se ma cha ke ko shi pa de ne ke ga wo je fe shi ete fe ni mi cha ke o bia ne papa se bon ke ya.
She's not the only one who menstruates in diapers. According to Jamila Mohammed, many women in Choko do the same. She does, however, add that when she does not have enough money for diapers, she uses toilet paper.
And you use pampers get zero. Can you my pampers and use zero? Zero Rebecca in your hair, come on, use over half my failure. My use 2 times. Hello, if we me tick or by your use 2 days, hello 3 days.
She gives a breakdown of why the rising cost of sanitary pads is economically squeezing many residents of Choko.
Baba feko kwa futu me enyo 5 cedi e ko nye 6 cedi alo 7 cedi o ayo enyo 5 cedi no manage ole naka bia ne no po enyo 5 cedi bia ne ko 4 cedi e o ba bula ga ko a he je epepa ni e ko a enu e ba gbo no epepa bia na 8 cedi no 8 cedi bia ne ko nyo 8 cedi besani o ya back no akota ko e alo ato ti roko no manage naka no cafe.
Activists have been calling on government to keep its promise of eliminating sanitary pads taxes. Social media has been flooded with posts explaining why the government should not tax women's periods. Esinam is one of the activists campaigning for the government to keep its promise of eliminating pad taxes. She tells stories about young girls who can't afford sanitary pads and have to resort to sex to pay for them.
We have seen in the news, we have heard stories, and they are real. It's not like someone is making them up, where girls are exchanging sexual activities just to be able to purchase sanitary pads. The prices it's just outrageous, you know, and it keeps increasing every day. It's becoming expensive to menstruate.
She makes a case for why the situation should be tackled with emergency.
In December, we bought a box of soft care pad, a box with 24 pieces at 95 cedis. You may want to do the division. Just last week, this same box was costing 165 cedis on the market. So you want to divide that by 24 and see the difference over the period. It's just outrageous, over 50% hike or increment.
Hagar, Jamila, and Ayele are pleading with government to pay attention to their cries.
His Excellency Nana Addo Dankwa Ekufu, we beg of him, he should reduce the prices of things.
Sister me wompi woblo wa yemo ahie ko waka abapo na ka wie pomis morning wo.
Ito makara ka bia ne benini bi jale wa iwo. Ekwa na che no fia na ga wotem ko wa benu chumo kwakwa ko no wachu.
This is a reminder to the government to listen to the cries of women and act swiftly. Ifwa Aprikwa Boafo's report, JoyNews.
Hungry man say, fix the country. Belefu say, fix yourself.
Well, a group of women members of parliament led by MP Fokete Saudi Fakomashia are advocating an ease in the access and affordability of sanitary wares for menstruating adolescent girls and women here in Ghana.
Before I became a parliamentarian in 2020, I volunteered as a board member for Days for Girls and also as a friend to the Ghana Girl Guide Association. And these agencies or these NGOs have been pushing for the taxes to be removed. So as an MP, I followed up with my colleague Betty Crosby, who is MP from African Plains. And she indicated that the year before our coming into Parliament, they made a lot of noise about the removal of the taxes. I also saw, and I think that you played that this morning, His Excellency the Vice President promising us that the taxes were going to be removed. So last year, when we read a statement on the floor of Parliament, Honorable Zuera of Sogah represented us and made the statement. We all contributed, and we were hoping that the institution that is to champion the affairs of women, which is the Ministry for Gender, Children and Social Protection, would take this on and assist us to reach government and to get the results that we wanted. But unfortunately, I'm sure you know what has been happening in that ministry. So the work has stalled a little bit. But here.
And now the Metropolitan Archbishop of Cape Coast, the Most Reverend Charles Gabriel Palmer-Buckle, has lauded the St. Francis Xavier Hospital of Asinfosu for being rated the Safe Care Level 4 health facility by an international assessing body. The Safe Care International Standards measure and the rate healthcare facilities levels of risk and fluctuations in service delivery and outcomes. Now, speaking to JoyNews, the Metropolitan Archbishop of Cape Coast indicated the recognition of the hospital that serves more than 6 districts will spur the hospital on to provide more quality healthcare delivery services.
The St. Francis Xavier Hospital at Asinfosu in the Central Region is one of the health facilities under the Christian Health Association of Ghana. The Catholic hospital over the years has been providing quality healthcare needs for more than 6 districts of the Central Region. The Christian Health Association of Ghana partnered Farm Access Ghana to use the safe care standards and methodology to assess, rate and benchmark quality among the CHAG network healthcare facilities. In the assessment, St. Francis Xavier Hospital was rated Safe Care Level 4. The Safe Care healthcare quality standards were developed through a collaborative work of Farm Access Foundation with the Joint Commission International and the Council for Health Service Accreditation of Southern Africa. Metropolitan Archbishop of Cape Coast, the Most Reverend Charles Gabriel Palmer-Buckle, says the rating of the health facility has been achieved by dint of hard work by the staff of the hospital.
When you go to the hospital, I myself have been patient in some of our hospitals, and I'm always touched by the simple people who really commit to seeing your well-being. Of course, one or the other person told me that, you know, they know you are the Archbishop and the rest of it. I said, well, I see them doing it for others too, and I like to encourage them to do it for everybody because we are brothers and sisters in Christ Jesus. I doff off my hat to all the doctors who are working very hard over there, to the nurses who work very hard over there, to the paramedical staff for their commitment and their sense of duty. I want to take the opportunity to commend also, especially those ancillary staff that very often do not feature in any praise and in any commendation.
He says the Catholic health facilities in the Central Region have generally been faring very well.
And I feel very elated that at least St. Francis Xavier Hospital has been, appraised as a very good institution, delivering safe care. In the peer review of the Central Region of all the healthcare institutions, which took place not too long ago, St. Francis Xavier Hospital came tops of all the institutions, both government, private, and the private sector. And even another one of our institutions came third. So your appraisal and your assessment and your commendation for our institution means it is really performing well.
Sister in charge of the St. Francis Xavier Hospital, Sister Georgina Donzen, says the recognition will spur them on to continue to provide quality care.
The sister in charge of St. Francis Xavier Hospital, Asinfosu. Yes, we have been rated as a level 4 facility among the CHAG facilities, which is a great achievement from an international body. It's like patting us at our back for the work we have done. So it's a joy.
The assessed facilities have been enrolled in a series of improvement activities such as training, on-site support, monitoring, linkage and access to digital tools, including a library app containing a lot of template samples of documents. Reporting for JoyNews, Richard Kwejunyako, Cape Coast.
You're still with us here on The Pulse. We're back shortly.